back, everybody, to Pivot Point of View. I'm Destri Millsap along with Becky Pearson. And last week we talked about hip labrums and all the different things that go with those, how to get them better, and what all to look for when you think you might have a labral issue in your hip. So this week, to go along with that, right close to the hip is your low back and back pain in general. So, Becky, what are some of the things that you look for in patients when they come in with back pain?
Well, one of the very first things that I check is what position is their pelvis. So I'm really glad we're talking about this today. I agree. I think this goes along nicely with our last week's conversation. Um, I feel like most back pain is started from a pelvis that isn't neutral. And so, as we know, the pelvis is what sits on our horse, and it is the foundation of your body. If you listened to last week, we talked about that. And so, the very first thing that I want to look at is their pelvis neutral? Most of the time, if they're having back pain, it is not going to be neutral. And, one of the most common things that I hear from people when they come in is, well, I go to the chiropractor and my pelvis is always out. And so I think that's really good for us to dive into that topic of your pelvis being out or not neutral. It isn't necessarily that your pelvis is like dislocated or a joint in there is totally out of whack. It's probably just not in the best alignment possible. So please don't ever think that if you're out, that you're like, that the joint is completely wonky. It is just that it is not in correct alignment. So if you want to say your pelvis is out, it is out of alignment versus, anything more major than that most of the time. What are your thoughts on that, Destry?
Well, some of the things that I look for and am careful of is any pain going down their leg or sharp pains over the midline. Those are things we really want to watch out for. For if you have pain over the midline, we're thinking possible disc issue, stress fracture, fracture in general. We have to be really careful of those when we're treating these patients. So taking a proper history, figuring out how long this has been going on, how they think they heard it, all those things come into play whenever I'm trying to get my treatment plan together. Then, like you said, it's pelvis neutral first and making sure that all those hip muscles are not spasmed and that their legs are even and their hips are even. They're not rotated on one side or the other, and making sure that all that is in neutral so it's not putting abnormal pressure on the low back.
I agree. And that is a good point. Obviously, I gather a history very first thing when I talk to people, where is the pain? Is it on one side versus the other? Does it shoot down your leg? Are you numb, tingly? All of those things do play a big part of that.
But yeah, I'll check and make sure that their legs are even, and then I'll make sure that their pelvis is in neutral and they're not rotated on one side or the other. And if they're rotated forward on one side, sometimes you'll see tight hip flexors on that side. So I'll make sure that the muscles on that side are not locked up, and I'll go to releasing hip flexors, which is incredibly uncomfortable. I was working on a guy one day and he goes, "Do you medicate people before you do this?" I'm like,
Here's a piece of leather. Go ahead and chew on that.
"Here before we work on the old hip flexor because that is tender."
Oh,
Shouldn't
yeah.
have waited so long. Anyway, so um, I'll release the hip flexor. I'll get in there, release that, and that'll immediately, because if you look at your anatomy, your hip flexor attaches along the lower lumbar. So having that in spasm is going to pull on those vertebrae, really that is a thing that a lot of people miss. And so releasing that hip flexor is important. And then once I feel like I have the muscles where I want them, I'll go to addressing the rotation with muscle energy, is how I like to do it. So it's usually a push pull type deal. And the first thing I'll do is I'll make sure that the pubic symphysis isn't locked up. So I'll put my hand between their knees and I'll have them squeeze. And a lot of times you'll feel a pop. And if you've ever got on your horse and squeezed your knees on your horse, at the first, and you'll feel a pop in there between your legs. Okay, so that's your pubic symphysis. And what that is supposed to look like this. Well, when you get that pop, that means it was sitting like this on top of each other. And you squeeze, it'll traction it and put it back where it's supposed to go. So now you can go like this a lot easier and it won't be locked up. So we'll get that, make sure that it's unlocked. Now I can address the rotation. So depending on what way they're rotated, if they're rotated forward, I'll activate the glute. If they're rotated backwards, I'll activate the hip flexor, and that'll pull that back into neutral. So once I do that, I'll go back to their leg length and I'll get my hands on the medial malleolus on both sides, on your ankle bone, the big bone on your ankle down there on the inside, and I'll measure on those and I'll see which one's longer. And on the short side, I'll just put traction, have them pull against me, hike their hip up, relax, and pull again. And I'll do probably about 3 push pulls on each of those things, the muscle energy and the leg length deal, to bring that back into neutral. I don't yank on people. I don't have to. And really, that's not what you're supposed to do in this profession. Chiropractors do that. They're licensed to do that. We're not, so I don't yank on people. And and so I'll bring that back into neutral. And really, I mean, like we said before with the hip labrum, it affects a lot of things when you're off. It can put pressure behind the knee. It can put pressure on your shins. People that get shin splints, a lot of times their hips are off. Calf pain, their hips are off. And like if you're rotated like this and all those muscles are on stretch constantly down the chain, once you put it back in neutral, now those muscles can relax. And so that's another thing. If you're stretching and stretching, but your pelvis isn't in neutral, probably spinning your wheels a little bit there because they don't have a chance to relax and shut off when you're actually in motion. So that's another thing that is very important. I'll put pelvis in neutral for a lot of stuff that people may not think of a lot of the time for that reason.
I agree completely. And I think I remember where I was going with this. So talking about leg length, yeah. Talking about leg length is if you are forward on one side of your pelvis, that'll shorten that side, that leg. Okay. So if I took a pelvic model here and I laid it on the bed and I shifted one side forward, it would shorten that leg. So I check leg length right away too. But instead of me going and pulling right away, what I do is I get that pelvis neutral again, and then I recheck leg length. Most of the time that takes it away. Now, sometimes if the ligaments are a little lax in that hip, that anterior side will be longer. And so there can be, if you are one that you're chronically unstable, you could have those stretch those ligaments out a lot. And so it's not necessarily a hard and fast rule for me all the time, but it is something that I look at. And then like you said, with once you get the pelvis neutral, those muscles start to relax. So it's amazing to me when you have somebody that comes in and they have pain going down their leg and you get their pelvis neutral and those muscles relax, like the piriformis muscle, which loves to go into spasm when the pelvis is not neutral. And that piriformis muscle travels right, or it's located right by the sciatic nerve. And so if it gets tight, if the piriformis muscle gets tight from the pelvis being in an abnormal position, then that can clamp down on that sciatic nerve and that can cause the referred pain. So there's a lot of different things that can cause that pain down the leg, whether it's tight muscles, piriformis syndrome on the sciatic nerve. It could be a disc issue. It could be a lot of different things, but we can't really get through all those layers of stuff until we get that pelvis neutral. So I think you brought up a really good point. And the other thing that you brought up that I loved was, what do you do first? You engage their inner thigh muscles to get their pubic symphysis neutral. And so what were we talking about a lot of our other podcasts, how important your inner thigh muscles are to the stability of your body, how important it is when you ride horse, how important it is when you have pelvic pain. Um, very, like I've said before, if you work no other muscle, work your inner thigh muscles.
And you mentioned sciatica. Absolutely miserable. If you have ever had sciatica, it is the absolute worst. It's terrible. And a lot of times people they're like, "Man, I must have a disc issue." And you can rule out the disc with special testing. So, not saying that that gets it every time, but a lot of the times you can rule out some disc issues through the special testing and know if it's just the sciatic nerve or hey, we got some distribution here going on and we're looking at some foot drop and things like that to determine if it's a disc versus a sciatic nerve, if it's maybe both kind of going on. And we can really make a good diagnosis on that through our special testing and being good with our hands that way. But sciatic pain, so when I had my ACL surgery, I developed sciatic pain down my leg and it severely held up my rehab. It was miserable. I was really miserable all the time. All I wanted to do was lay down because that pain was just always there going down my leg. It was terrible. No one could get it shut off. So I go to doing a bunch of research on how to fix myself. And what I found was there is a ton of trigger points that'll line up down that sciatic distribution, all the
Mhm.
way from your piriformis to your hamstring, all the way down into your calf.
Mhm.
Well, so I went to attacking those. And what do we know about the sciatic nerve and back pain in general? What you do to one side, you have to do to the other side. You can't leave one side out there because when there's a chink in the chain, you don't know where that distribution is actually coming from. So you have to treat both sides. So I would treat all the triggers on the side that I felt it, but I would get the most relief. Strangely, this is like voodoo stuff. Strangely, I would get the most relief when I would treat the side that wasn't having symptoms. And so I would go down this whole distribution, starting up there in my glutes where the piriformis likes to live, and go all the way down my hamstring with this certain trigger point map. And I would hit all those triggers with a lacrosse ball, release them, and my symptoms would relieve. And I would do this constantly. Anytime I had symptoms, or even if I felt it getting a little bit tight or whatever, I would hit these triggers so I could go on with my life. And I would also work on gliding that nerve so it could move and be unrestricted and improve my range of motion there. And that's one thing that people miss with hamstring flexibility is they don't glide the sciatic nerve because when that nerve can't glide, those hamstrings automatically tighten up. And
Mhm.
so you glide the nerve too to improve proprioception in the hamstring. So that's another important point. But sciatic pain, a lot of people will, I wouldn't say misdiagnose, but they will take sciatica different from just you probably have to release those nerves. It's not just inflammation, it's restriction. So get down on your hamstring, calf, piriformis, get those knots released and see those symptoms go away.
Yeah, and I know you just went to a dry needling course not long ago. That's one thing that I love to treat sciatica with dry needling to the back of the hip. Really get after that piriformis muscle with the dry needling. There has been so much improvement in people when I do that. I mean, if it is true sciatica that is caused from or true piriformis syndrome type stuff, or just you're getting nerve pain because of tightness in the muscles in the back of your hip or down your leg. That dry needling is like second to none on treating that very effectively, very fast. So I love that. And then the other point that you brought up about stretching flossing the nerve, those muscles get tight, but I think people think they forget about the nerve getting tight too. The nerve is intertwined within the muscles. And so and how you glide that nerve, like Destry was talking about, basically it's like a hamstring stretch, But then you also like, I like to have them stretch their hamstring and then pull their toes up towards their nose. And you put that whole sciatic nerve on stretch, and it may actually make your numbness, tingling, pain a little bit worse initially. But then once you release that stretch, it should actually relieve your symptoms quite a bit. Now, if they have a bulging disc involved with that, sometimes it can irritate it a little bit more, but you do still need to stretch those muscles and stretch the nerve. And you just have to balance that out with, not making your symptoms worse per se.
Agreed. And so when we're talking about low back pain, we got the muscles where we want them. We're still having some issues. So the next thing that I'll go to is what kind of orientation are the vertebrae themselves in? Are they rotated left, right, tilted certain ways? And so Kim talked about that in horses, finding the pathway of least resistance for that deal to go back in alignment. And it's not just, you're not going to just look at the low back if they're having pain there. You're going to look at how is the T spine moving? How are they in their neck? Working with Doc Blanton, he taught me a lot about how the spine all, if it if it's not all lined up where it's supposed to be, then it's not going to move correctly, and it'll come out in different areas, whether it's between the shoulder blades and your low back. It could be all the way up in their neck. And also jaw is closely related with hip alignment and stuff. If you're down in your hips on one side, your jaw is going to be down on that side too. And so you might even have to fix their jaw. I mean, there's a whole bunch of different things that go into fixing these backs. They're very interesting, and sometimes they're very hard to fix. And the people that have chronic problems, they didn't get everything all the way lined up, most likely, unless they have like a disc that gave out, or spinal stenosis, or obviously a bad traumatic injury, those types of things that got missed. Some of those things are different, but on just the chronic pain issue, you have to make sure that everything is lined up and moving. It has to be able to move. And so all those muscles going up the back and all the way up into the neck, they have to be moving. The multifidus has to be moving. That runs all the way down your transverse processes, all of those things. And so if you're rotated one way or the other, you'll feel like one of the pedicles is, or transverse processes, is deep on one side and one of them is more superficial. So that'll tell you which way it's rotated. Then you can choose how you're going to get it to come back. And so if it's hung up, sometimes you can take it more towards the rotation side to unhang it, and then it'll come back into alignment easier with, I mean, very, very subtle and little pressure. I mean, nothing. You don't even have to jam on them. And so there's a lot of different things to look at there, and a lot of the people that have had low back pain, and people just treat that one spot and they get tuned in and tunnel vision on that one spot. That doesn't fix it a lot of the time. And then you go back into, okay, now we got everything lined up and moving, still having back pain. Is it a kidney issue? I mean, it's a whole rabbit hole. Is it a kidney? Is it, female organs? They attach back there to the sacrum and can refer pain back from the ovaries and everything else. I mean, it's just a whole rabbit hole, and you have to look at them and ask questions on their history to determine those other factors that aren't just right there in that one spot where they're having pain.
Yeah, for sure. And talking about the vertebral alignment above the pelvis, that's one thing I notice is once I establish pelvis neutral, a lot of times, unless you have severe muscle restriction, but a lot of times the vertebrae will start to align themselves with the exercise program that I give people. And so, sometimes I'll give people a program and then they'll come back a few days and they'll be like, oh, I just hurt so bad. I couldn't do my exercises. And I do just want to pull my hair out when they tell me that, because the exercises that I give you are designed to help get you out of pain. And so I really truly want them to try doing the exercises when they are in pain because it should give you relief. You know, my philosophy is I don't want people to always have to come to me for pain relief. I want to teach you how you can relieve your pain by yourself. Our muscles pulled us out of alignment, so why can't our muscles pull us back into alignment? You know, people are really good about stretching when they hurt, but they're not good about strengthening when they hurt. But they also maybe don't know what muscles to start to strengthen when they hurt. And so that's where I think it comes in, Destri and I, people that are very knowledgeable about, okay, we've got to shut off this muscle, we've got to engage this muscle, you know, and this is how we do it. And this is how you're going to have to work at it to keep yourself in good alignment. And this isn't just a one and done, you know, you have to, this is something you have to work at to keep yourself in good alignment. You know, people that are very active into their 70s, 80s, 90s, they are not that way because they just sat on the couch and did nothing. You know, they took a very active stance in staying strong, staying flexible. This is something that you're going to have to do at some point along you have to decide, I'm going to stay strong. I'm going to keep exercising to maintain where I'm at or even get better at where I'm at. And the older we get, the harder we have to work at doing that.
Movement is medicine, period. Movement is medicine. And you have to create strength and resiliency. I mean, and especially like rodeo is a sport,
Mhm.
ranching is a lifestyle where you have to be strong. And you get a chink in that armor, you have to figure out how to fix it. And so core strength is huge in our sport. Core strength. It is everything, helping you stay up with your horse, helping you get up to rope, all of those things, helping keep the pelvis in neutral. It's not just hip strength, hip mobility. It's not just the mobility. You have to have resiliency and strength in those muscles. And I agree with you. And some people, they might just be absolutely miserable and it might take a little bit and we might have to regress their exercises
Yep.
so that actually perform something to get them moving. And a lot of times I will see that the first week we get to doing stuff, those muscles have been shut off, they haven't been used in a while, so they're going to get sore because we activated them and we probably hammered on those muscles too, doing some soft tissue. They're going to be sore, but
Mhm.
that'll eventually work its way out. And when you activate those muscles, what else do they get? Blood flow. And what else happens when they get blood flow? They push the bad stuff out. And
Mhm.
so that's another important aspect of their rehab program. We have to move. We have to get it moving. We have to create motion with our muscles and doing our mobility so they don't hang up as much and just keep on going through that pain. Now, I will somebody comes in and they're like, "Man, I'm really sore today." Well, I'll check everything, make sure that it's in alignment, and if it's a sore muscle, I'll know how to address that and I'll get them to some sort of baseline so that they can perform some sort of exercise. And I might go away from that area a little bit and we're like, all right, we're going to just try our hardest to shut this area off and activate other areas to help it that are around that area. And so and a lot of people like there's always these generalizations with back pain, like, oh, your back hurts because your hamstring is tight. Well, did we ever look at why the hamstring was tight? Did we ever look at that? Is the hamstring tight because they're rotated forward on that side and it raised the ischial tuberosity, pulling that hamstring into a constant stretch? Is that why? Is the hip flexor locked down, pulling it into that forward motion and pulling that back attachment up, putting that hamstring on stretch? Did we look at that so we can maybe just put them back in neutral? And now our hamstring isn't near as tight. There might still be some trigger points in it from overuse and working harder than it's supposed to, and we can release those and get it back shut off. But it's not just a, you know, it's this or that. There's so many other things you have to check. But yes, like you said, you got to move. You got to strengthen the hip muscles around it. You got to strengthen your core around it, and even your upper back muscles. posturally, you gotta get them shored up, because if you have weakness up there and you're compensating down lower, then that's not helping you either.
Yeah, 100%.
Your postural restoration store stuff that you do, the postural restoration techniques that Becky uses are absolutely amazing. I mean, you'll be in these positions that you're like, man, how did I get here? And I don't know how to get back out of them. But then all of a sudden, everything is functioning like it should. And you're like, man, I didn't feel that muscle before, and this muscle's turned on, and this one's not. And that postural restoration stuff is so cool. Do you want to talk about that a little bit?
Communication. That's the thing. Like, I want people to make sure that they communicate with us. So, like, when you are,
How funny that you like.
I blanked on communication. Okay.
I don't know what else to say. Like communication, yes.
Sorry. Yes. Well, so this happened just last week. So I use the postural restoration approach, like Destri was talking about. And I had this gal that there's a lot going on with her, like seriously, like scoliosis, aged rider, a lot going on with her, and get her repositioned in her pelvis, and she got sore, got really pretty sore. And instead of us working through this, she just wanted to cancel everything, because she didn't like the fact that she was sore. And, I had talked to her about, hey, we can back off a little bit. We can modify some things. Let's check and make sure the exercises are going okay. But the big point that I wanted to bring back is communicate with us. Let us know, hey, this is too much for me, or this is what this did for me. This is what it made me hurt worse. I didn't get any sleep. Because even though we have used this stuff on so many people and it's been very successful, each person is an individual, and we need to address your individual needs, and help you through that. So please make sure you let us know what's going on, and don't jump ship after just one appointment because you got sore, because we can make adjustments. We can change things. We can do more soft tissue work. We can do so much more than just that set of exercises. And so just, communicate with us about what we can do to make sure this program works well for you.
I agree, and I try everything I can to get it in one shot. I probably try too hard sometimes. And here's the deal. When you let stuff go on for so long, and that's been the struggle working with the, 25, 30 to 50 or 60-year olds, that you're getting people that they've had this movement pattern for a while, and it's takes a long time to get that changed. And so as much as I try to make it a one hit wonder and a one shot deal, and if we do get it in one shot, great. That's awesome.
Mhm.
And the older I get, the more, because I was terrible when I was younger. Like, don't, if you told somebody it was going, they're like, oh, well, they're just going to tell me, if I go to the doctor, they're just going to tell me I can't rope anymore. And I avoided it like the plague. Well, now I send people to the doctor because that was a terrible, terrible approach I had. So you have to tell people what's going on. Seek help early. The
Mhm.
earlier you seek help, the less things you're going to have to fix. And so that's another important part of it.
Yeah.
But
Yeah. Um, the getting the help early is so, so important. And the aged person and rider, and I agree with you. Like, a lot of times I feel like I have one shot with these people, and that first time that I'm with them, either make it or break it. And so um I'm a lot like you. Like, I try to give them about everything I can think of on that very first visit, because I want this to be a good experience for them. And but sometimes we can overdo it. And so we do need to balance that out. And again, that goes back to that communication of letting us know, you know, how much time you have that you can exercise. You know, we did a joint co-treat on a person a couple weeks ago, and she's like, you know, I think I can dedicate about 15 minutes a day. So, you know, Destry and I worked very hard to make sure that we didn't overwhelm her with too many things that first appointment, because we wanted to make sure she had success and she felt great. And then she came back that second time and she did. She was a rock star and did so good with everything that we had given her. So then we progressed her on that second visit. So very good points on that for sure that you brought up, Destry.
And we have a lot of different tools in our tool bag for fixing backs. There's so many different treatment techniques we know. And if one of them doesn't work on somebody, that's okay because we have 5, 6, 10 other things that we can do. Like Becky was talking about the dry needling. You know, when you put it, they come at me with a 75 needle, gonna put it in your piriformis, which is in your glutes. And I'm like, I don't got enough glute for that 75 needle. And they're like, "Oh, it's okay. We're gonna do it anyway." I'm like, "I'm telling you, this is not gonna go well." And so that's not for everybody. It's a really great technique though, and it is very effective. And the people that can take those needles and not think about it, those people are gonna do very well with that treatment. That's not for everyone. I mean, we had somebody in our needling class that was scared to death of needles, and that sucker got stuck 27 hours and passed out once and come back and everything else. And we're like, yeah, this maybe isn't for you, but somehow he got over it and still was able to do it. And all of us felt better after we did it. But if that's not for you, if the dry needling is not for you, I understand. I don't love it either. Even
Yeah.
though it's a effective technique, I don't love it. And so we can do cupping, scraping, different types of soft tissue, different types of mobilizations. There's way more than one way to skin this cat.
Mhm. I don't love the dry needling either as far as when it's done to me, but I love how I feel afterwards.
I'd
And
almost be worried if somebody liked it. I'm like, what's wrong with you? You like being
exactly. Yeah.
you,
And I don't show people the needles before, like if they've never had it, like I definitely don't show them the 75 before I put it in. I sometimes they'll ask to see it afterwards, and I will show them afterwards, but I don't before because I don't want them to freak out on me. And so 75, you guys, is like this long. Like it is a seriously long needle. But if you think about how else can we get to those deep, deep muscles of your hip, okay? Even if you don't have much for glute tissue or things like that, like we still need to get those longer needles to be able to get to those deep muscles of the hip for sure.
and don't just like, oh, I only got 2, 3 days relief. That didn't do anything. Well, if you've been hurting for 3 years and you got 2 or 3 days of relief, we probably just need to keep on keeping on there and
Yeah.
finding out other things because once we fix one thing, there might be something else that we didn't see the first time. So now we got everything where it's supposed to be, and something else rears its head up and like, oh, I'm tied over here. Oh, now we didn't know that before because everything was so out of whack. And so you kind of just keep getting every little piece dialed in with consistency in your treatment plan. Now you're going to have a better chance to be better as a whole and for it to last. That's the next thing is once we fix something, I want it to last. And that's the importance of doing your exercise program until the next time I see you. I work on some clients that some of them I only see once a month because I can only make it down there that once a month. And they get any type of relief in that time period. I always make them an exercise program. I'm like, look, do this. It may not get it all every time, but the more we keep going on with this, we'll keep getting it dialed in and dialed in. We'll know what exercises work, what exercises don't work, and
Mhm.
we can make those adjustments. The longer that you work with somebody, the more you know where to look. Hey, this feels different this time. Oh, this feels better. All right, cool. We don't have to spend as much time on that part because it feels better. And then you can go right to those other areas and be more time efficient and a little bit less torture. That's always good, having less torture on some of those areas that we've already beat on before. But and look, I'm okay if I didn't fix you the first time. I'm okay. You're like, man, it just still doesn't feel right. Yeah, tell me. I'm not gonna feel bad about that. I'm gonna just keep looking and keep digging and be like, you know what, this has been this way. So those muscles probably need to calm down before we take the next step. Here's how we're gonna calm those muscles down. And that's fine. I'm totally cool with that. I had a person one day tell me, it's like, hey, how you feeling? Whatever. They're like, man, I felt good for 2 weeks. Do you think I should get an injection? And I'm like, time out.
Mhm.
Felt good for 2 weeks after feeling this way for like 2 years. And then we went straight to injection. Well, I'm not saying that injection isn't good sometimes. Like if you're in so much pain that we can't even do what we're doing and get you any relief there or make it last and that injection is needed, sure, we'll get the injection. But then if you don't fix this is what we talked about a couple of weeks ago with Kim and in some of our other podcasts.
Mhm.
If you don't fix the issue that made you get that injection, you will have to get another injection. And then you're just getting poked with needles. And maybe they'll last 6 months. Maybe it'll only last a week the next time. You don't know because you didn't fix the actual issue. So make sure that people pay attention to that whenever you're talking about injections and things like that. Well, why does this hurt? We have to figure that out. Otherwise, we're just gonna keep getting drugs pumped into us and hope it's almost like you're putting a Band-Aid on something, even if it is an injection. And so if you have to have that so we can function and get you back to baseline, that's totally fine. But it's not always just the end all be all.
Yeah. Don't just quit because the injection gets you out of pain, which a lot of times they do. But if you've never restored the strength and the range of motion, like Destry said, to keep you out of that pattern that got you there in the first place, then it is only like a Band-Aid. There is definitely a place for injections. They're definitely needed. And same thing, like with pain meds. Sometimes you need them to function, but while you're taking them or while you have that injection on board, then let's work on getting you strong enough to hold you into a good position instead of a bad position. Don't let yourself slip back into the old patterns that got you there in the first place. The other thing I wanted to talk about were diagnostics. I love diagnostics. I love when a person comes in and they've had x-rays or an MRI, but you are not your MRI. You are not your radiology report. So if they say you have a bulging disc or you have joint degeneration or you have disc degeneration or you have stenosis, that doesn't mean your life's over. It doesn't mean that there's nothing you can do about it. No, physical therapy cannot take away the degeneration in your spine, but we can help those muscles move better. We can help you gain strength. We can help you get back to moving better. So I see this all the time. I see people are like, oh, yeah, I have a bulging disc, oh, I'm just going to have a crappy back the rest of my life. No, you don't have to. There are so many things that you can do to improve your quality of life. I actually went through pretty serious episode of back pain industry. You are unfortunately involved with this. So a couple years at years ago at nationals, Gracie and I were flipping. We had taken a little pool, to sit in the hot Gillette summer, and we were draining it because it got dusty. And I was flipping it and probably not using great body mechanics. And my back, I felt kind of a little pop, and my back started to spasm terribly. And it was a very interesting and humbling thing for a physical therapist to go through. Like the next morning, I could barely put my pants on. It took me like an hour to do that. Um, it hurt to ride. It hurt to do so many things. I later did come back. When I got home, I did get some x-rays, and I really have no disc between L5 and S1. Um, and so it really took me thinking, okay, what you have to practice what you preach, Becky. Like you have got to get yourself in better shape and you've got to do things to um, really help your spine get in better alignment. And so I went to work very hard on improving the position of my sacrum because instead of being at a gentle angle, it was like this. I mean, and then my fifth vertebrae was, so if this is my sacrum, instead of being here, it was here, and then my fifth vertebrae was actually slipped backwards a little bit. And so I had to work very, very hard to improve the position of my sacrum, which then I also worked hard on getting better alignment of my spine above that. And so if I would have just stopped right there and said, oh, I don't have a disc between L5 and S1. My life is doomed. I can't do these things. I can't ride my horse. I can't do this. I can't do that. Like, and then think, oh my gosh, I'm 50 years old, I'm just getting old and this is the way life is going to be. I would have lost out on a lot of great things that I've been able to do since. So don't just think because you have that diagnosis or that MRI result or whatever, that is the end of your life as you know it. There is so much that we can do. Yes, the diagnostics help us hone in on what really needs to be done, but don't think you are what your MRI says.
And we talked about a few weeks ago the mental aspect of things. What is your mindset when you're going through an injury? It's hard on you. It's really hard to wake up in pain every day, try to get through your day, try to do your normal daily tasks. We get it. Like that's
Mhm.
why this communication is so important is we know that it's miserable for you. We're not going to hold it against you for being hurt. We're just not. We've been hurt ourselves. We understand what pain feels like. And so having that communication of this worked, this didn't, is very important to us because if something's not working that I know should be working, then I'm going to get you to somebody else or I'm going to go deeper into the rabbit hole and try to find a way to fix you. And so that's, I mean, a lot of the referral stuff is just like, man, okay, so we line this, and this up. We're still having this. It could be a disc issue. It could be a stress fracture. We have to know. So then I'll make a referral. And so getting back to me on stuff that doesn't work or is working is so very important. And then also just please stay consistent. Stay with your treatment program so we know, all right, this didn't work last time. All right, no problem. I got a different technique. We'll try this technique. Or man, this one really hurt. Can we try something else? Absolutely. I got a million different ways I can fix that. So that communication aspect is so very important. There's been a lot of times, and you might have to. I might ask you to go back in your thinking, and I'll just keep asking questions on when exactly does it hurt. So pay attention that when this thing gets you, know exactly when, and be able to tell your therapist or doctor or whoever you're going to, chiropractor, whoever, be able to tell them this thing that I do, this activity at this point, that's when it hurts. And so I'll give an example. So I worked on a baseball player one time, low back pain. I got everything lined up. I got all the muscles loosened up in his back. Everything is moving great. Well, he goes back to hitting, pain immediately comes back. And I'm like, my goodness, like what else could it be? And I don't hold it. I mean, the guy's in pain. That's fine. We got to figure this out. So I go from the back down into the hips. And what do I find? He has poor internal rotation on on that side towards where he's rotating. He has poor internal rotation. So every time he hits that, he can't go over that hip anymore. And then his back just takes the entire hit. We
Mhm.
fix his hip internal rotation, money. Doesn't have any more pain ever the whole rest of the season. So keep coming back, keep telling us what's going on. I will go into that rabbit hole and try to figure it out. And if I can't figure it out, that's when I'm going to use my network of people, refer you to somebody else that get a different set of eyes and try to get you better that way. That's so important. And working on backs especially can be very humbling. And I would love to say that I fix everyone. I don't. I wish I could, and I try my very best, but I can't fix everybody. That's why I have a network of people that can do things that I can't do. And and that's why I constantly push myself to be better.
Yeah, amen to that. And just again, the communication piece of us communicating then with the next person we send you to. If we are good at what we do, it doesn't mean that we are going to cure everybody. We're going to heal everybody. We're not God. We're not Jesus. We can't do that. But we can sure help get you um along the road further and give you some tools to get yourself better. And if we can't, then we better help you get to the right person that can help you. And then stimulate that conversation of saying, okay, Susie did do this, and this in therapy. This is where we're still struggling. This is what she still has problems with, and if we've done everything that we can and we're still having problems and pain, then yeah, maybe we do need an injection. Maybe then we do need, something else is missing. And maybe it is that, maybe that disc or whatever is back there just does need to have surgery. That I'm not going to say every patient that I see never has surgery. Sometimes that is needed, but hopefully we've laid all of the good foundation beforehand so that after they've had surgery, they have better outcomes. And then let's look at things after surgery and make sure we stay strong and stay out of those patterns that got you to that surgical point in the first place.
Right. The mark, and you said the mark of a good clinician is somebody that will listen to the patient, and a good patient advocating for themselves is going to only help themselves out. I have, I don't know how many people I have call me. They're like, I've been 6 different places. I haven't had any relief. And I'm going, I'm an athletic trainer. Like, how did you even find me? But people don't even talk about these things with athletic trainers trying to fix them, and then you've been to 6 different people, and I'm like their last chance, and it's kind of
I'm sorry, Destry, you have fireworks going off behind you.
yeah, I'm here. Here I am. I will fix you the best I can. But yes, go on. Anyway, yeah, so I mean, I find these people where I'm like their last resort, and it's very humbling to me because first of all, I feel terrible that they've been to all these people and haven't experienced relief, and it's a little bit intimidating. I'm like, oh my God, what could I possibly do that these people didn't do? And so I'll just listen to them and try to look at so many different things that could have gotten missed, and have had success, luckily, with a lot of those people. And so thank goodness for the grace of God and pushing me to always get better and always try to help people the best I can, because where I was 5 years ago in my career or the start or anything like that, I'm much further ahead. And if I wasn't, then I wouldn't be very good at my job. So just constantly pushing ourselves as clinicians to get better is so important, and listening to our patients. That's when you know a good clinician. And like we said before, I don't remember what episode it was, it might have been a couple weeks ago, when we said if you're going to withhold information from us to see how good we are, man, we're probably not going to be very good for you. I'm just going to tell you right now, because we're going to miss something that would have been vital to that piece that we were needing to put you back together.
Yep. We probably don't need you as a client if you're not going to talk to us.
It's, it's it's already hard enough to fix you. Don't make it harder, please.
Exactly. Exactly. We are not mind readers. Yeah.
uh,
Here. All right.
so
Anything else you can think of on that topic? Sorry about the we've had a variety of things. I'm really liked the fireworks effect. So if you're not watching this on YouTube, you need to go watch it on YouTube to see the fireworks behind us.
uh, Siri was just like, "Come on, preach! I'm telling you, talking about the truth. Fireworks everywhere." It was like 4th of July. I'm looking at my screen going, "Man, He's like, man, speak the truth. Keep going, preach." But might be some pretty good outtakes from this episode. You never know. You
Yes.
might just tune in anyway. But not take
I
them
just
out.
leave 'em in, yeah.
Post it live, raw. Here we go. But no, I don't have anything else on back pain, thank God. I'll probably think of something else later,
Yeah.
just because my hamster got tired of running. But anyway, so if you think about all the things that we just talked about back pain and ourselves, stay tuned because can you imagine what's going on in your horse's back with us on them, all the different things that their back has attached to it and everything else. Stay tuned. We're going to talk about that next week. So thank you all for listening. And as always, have your health be the pivot point to your success.
I totally lost my train of thought.
Oh, weird. It was me last week.
Okay, where was I going with this? I don't freaking know.
I had a direct, and then I lost. I had it, then I
Had it?
lost.
I had this vision of where I was going with it. Um, okay, what were we talking about? Yeah, okay, how did you end your thing? You talked about get the, oh gosh, just take over, Destry.
Go to commercial break while we gather our chicken, and we'll come back to the flow back. Here we come.
Go for it.
um,